I'm going to imagine it's faster to get back to the trailhead on your own and get in the car than sit there and wait for an ambulance.
If stable,
if you're stable,
bleeding, breathing, then those are decisions that you have to make on the fly. Calling helicopters, calling ambulances, and calling search and rescue is absolutely still on the table and recommended if you're just in the screwed department.
Lube your chain and pump up those tires. It's time for Aging on Dirt, where we defy expectations one pedal stroke at a time. We age, but we don't have to get old, and we all want to experience the joy of mountain biking as long as possible. Are you starting to ride at an unreasonable age, getting back into it after a long layoff, or just wanting to extend how long you'll be riding? Then you're in the right place. And now, your host, Joel Zieve.
I'm sure you'll agree that there's been far too many catastrophic crashes on our trails this season. This got me thinking, what should we do if we're injured on the trail? Perhaps one of our riding partners, or we're just riding along and come upon someone who's been hurt. My guest today has seen more than his fair share of accidents in the mountains. Dr. Jeff Hershey is an ER doctor at McKay Hospital. Technically, he's board certified as a certified emergency physician. He also has his wilderness medicine fellowship and is a volunteer ski patroller. Lucky for me, he's my neighbor too, so we sat down to talk about what to do in these exact situations to make our chances of a faster recovery possible, but also in many cases, increase our chances of simply surviving. You're going to learn a ton and also be overwhelmed with the amount of passion Jeff has for serving others as a first responder. I'm not really sure what was going on with my mic, but I do apologize in advance for the quality of the audio on this one. Enjoy listening in on our conversation. Here you go.
Welcome, Dr. Neighbor Jeff Hershey.
Thank you very much.
Because I remember just talking to you from your ski patrol.
Right.
And the stories that you had, and probably just the best general story about working in the ER is how you hear constantly. How do you tell it? People just come in and say, "I was just minding my own business."
Minding my own business. It turns out minding your own business is extremely dangerous.
Even on mountain bikes.
It would seem.
So I thought, especially over the last few weeks, so many people getting hurt on bikes and getting flown out. And I thought, just getting some ideas for being prepared, helping people get in a position that if they are injured, to give you and, or whoever's team is on in the ER, giving them the best chance to help us for the fastest recovery.
Absolutely.
So that's kind of high level what I was hoping to cover with you, and your stories are always entertaining, so we'll just kind of see where it goes.
Thank you very much for having me.
Thank you, and thanks for coming all the way over. Jeff lives right next door to me, so
it was a trek. I almost had to ride my bike.
Yeah, right. So why don't we start off? Just tell us so people know how old you are, where you live, and your favorite area to ride in that's close to your house.
Yeah, I'm barely and brand newly 50 years old.
Okay, 5. So you're starting your 6th decade.
Yeah, I guess so. That's really, it hit hard a little bit actually this time. It smarted, stung. But I live in Eden, Utah. I grew up in North Ogden. And so I've been in this area as a local primarily for, my whole entire life, really. And I love mountain biking locally. I love Snow Basin. That's where I ski patrol, so it's really fun to see it in the summertime and experience the mountain in the summer. I love North Fork, and I grew up going there, so it's been really interesting to see it transform into a mountain biking mecca. Really, it's almost its primary use now. That may not be completely true, but it certainly seems it by the numbers, and it's just a gorgeous, unbeatable place to ride, in my opinion, and I have a lot of nostalgia from growing up and camping and picnicking there with my family.
Okay. All right, great. The introduction was relatively brief by me, so if you could dive a little more into detail, because you obviously understand your background better than me, is why are you qualified to even have this conversation?
Well, I may not be. I have a lot of background in my interest in helping save lives started when I was 11 years old, and I was at Donut Falls in Salt Lake City, and a 11-year-old boy fell off of this big giant rock cliff and was unconscious and bleeding from his head and drifted down the water and got caught up in some reeds. We ran down, took our shirts and pants off, made a stretcher with some sticks, and carried him down to where a helicopter came and picked him up.
Wow.
And we were part of saving his life. From that point on in my life, I was very young. I was 13, maybe 14, maybe.
Mm-hmm.
From that point on, I just wasn't able to really find any massive satisfaction in doing other things. Whatever kind of work, it was really hard to find the same satisfaction that I got from using my skills and my knowledge in a moment of crisis to help my fellow man. That's what drives me, is that I need to be there for you when you need me.
That's awesome.
I love that, and I've always loved that. And it just evolved and grew into maybe me being qualified to have this conversation. As I went into search and rescue early on in my life, and was a part of Weber County Search and Rescue for 10 years. And so I know these mountains, I know these hills, I know these rivers and canyons. I know them very well because I've been in them for many, many years on lots of different rescues. That then moved into ski patrol. And I've been up at Snow Basin as a ski patroller in different capacities for now around 23 years.
Okay.
And that evolved into a more focused view of working in medicine. And I went to medical school. And
so how old were you when you started medical school? Because it sounds, you didn't go right in.
I did not go right in. I was a
right
little
after high
bit
school.
non-traditional for sure.
Okay.
But I kind of enjoyed that idea of having a lot of experience in that prepared me in a different way for medical school.
Right.
I had my EMT and my paramedic already. I worked in the ER already, and I worked in these different capacities for my community. And it really informed a lot of what I studied. And I had the background of all those cases that would pop into my head as I would study, and oh my gosh.
So I would imagine it would sink in a lot easier.
It was really
with having all that experience. Yeah,
it was really helpful to me. And then I chose emergency medicine once I was done through medical school. I went to medical school down in Las Vegas, and then I did residency at Michigan State University in Lansing, Michigan.
Okay.
I was there for 4 years, and during that time, I studied at the University of Michigan for a wilderness medicine fellowship.
And who do you root for when they play each other?
Well, it's kind of funny. I would wear my green scrubs to the university, and I would wear my blue scrubs to state, and I'd walk down the halls of the hospital and watch people spontaneously combust.
And you did this on purpose.
I did this on purpose.
Of course.
There's really no sports affiliation, but it bleeds out of them there.
Right.
It was so wonderful to see, and I would pretend I did it accidentally.
Right.
Oh, how could I have done this? How could I have worn my blue scrubs here? And, people would melt, and it was wonderful. It was really wonderful to see that rivalry.
I'm sure it's crazy.
Out there. Loved it. So during all this training, you're certainly exposed to every kind of imaginable injury and illness and tragedy that you can possibly fathom.
Mm-hmm.
More than I ever thought of. And still there's more every day that I work. And now I work locally as an emergency physician and still ski patrol up at Snow Basin as their on-hill physician.
Okay.
So I'm still very intimately involved in our community, and I see the injuries, the accidents, and things that happen as a byproduct of our lifestyle. One of those is mountain biking. Wilderness Medicine Fellowship is basically the paperwork to the byproduct of my life. I guess that's how I would describe it. Is my dad put a backpack on me when I was 2 years old. If it's outside, I'm in.
Okay.
And so my whole life has been outside, in the weeds, in the trees, on the rocks, on the ice, down the river. And that's all I really actually know.
So this fellowship is basically documentation that says you know not only are you qualified in the emergency room. You're qualified when you're outside.
It's a way of saying that, yeah.
Okay.
It kind of is the academic paperwork to what I do normally. I really loved it, and I still use it on a daily basis in the ER.
Okay.
Yeah, got bit by a rattlesnake, got bit by a raccoon, slid off this mountain while rock climbing. What's this plant, doctor? And people come in, and my boy ate this berry. Is it poisonous? Is it going to kill him?
How'd this stick get in the side of my neck?
All these things, everything.
He sent me this text yesterday, the day before, with this guy with a stick broken on the side of his neck, and I'm going, what the? He said, I didn't know if you were going to have visuals for this.
Well,
I'm like, this is why I don't.
Into the lateral side of this guy's left neck while he was mountain biking, and it jabbed really deep into his neck. They were smart enough to leave it in place,
Okay.
but they broke the rest of it off. And that's
So was that smart also?
smart to leave it in place.
Right.
Don't pull an impaled thing out.
Okay.
If it's not bleeding right to death now, leave it. So he was actually fairly stable when he arrived, and we got CAT scans and antibiotics and prepared him for surgery, and he went to surgery to have that removed.
And they drive him down or ambulance?
They drove him down.
Okay.
And that's kind of prototypical of a lot of mountain bikers. They're fairly self-sufficient people. They're tough people, and they know what they're
Well, I would imagine it's faster to get back to the trailhead on your own and get in the car than sit there and wait for an ambulance.
If stable,
If you're stable.
bleeding to death, and if you're breathing, then those are decisions that you have to make on the fly. Certainly, calling helicopters, calling ambulances, and calling search and rescue is absolutely still on the table and recommended.
Mm-hmm.
If you're just in the screwed department, and everybody kind of generally knows when they're in the screwed department.
If you and I are mountain biking and you get hurt and you can't make any decisions, and I just call 911.
Yep.
Who decides if it's I'm throwing you in the car or we're sending a helicopter?
Well, apparently you make that decision if I'm unconscious.
Do I? I mean, is it, or it's a conversation with the 911 operator where they're asking me enough questions where we're both making a decision, or?
Great question. And the dispatchers are very, very trained. They know exactly what to do. They hear these things often, and they can help make those decisions with you. And that's a really important point and a really important call. Sometimes you may not have cell service. Sometimes you may not have some of those things, and you have to make some decisions on your own.
Mm-hmm.
Getting people out of difficult places is part of what we need to be generally prepared to do in our minds and in our just having some amount of training to think in that way.
Okay.
How do I think in these moments of crisis? Losing one's mind generally doesn't help.
Right.
Having a very focused, calm, deliberate demeanor to make clear decisions on what needs to happen as quickly and as efficiently as possible is the best way to go about it. I have never seen panic help.
So besides staying calm, what tips can you give us to help make those kinds of decisions?
It may go back to your very first attempt at learning first aid in the first place, and that's airway, breathing, and circulation.
Okay.
The ABCs. It starts that way for a reason. Is my buddy in the dirt breathing?
Mm-hmm.
That's like your only number one priority. If we're not breathing, you have nothing else to do.
Besides get them breathing.
Fine. You have to get them breathing.
Okay.
If they're bleeding to death, you have to stop it. How do you stop it? Well, that's direct pressure, tourniquets, belts, any number of things. You have to stop bleeding.
Okay.
Beyond those 2 or 3 obvious things is to then sit back and assess the situation. Where are we? Do we have cell service? How far away are we?
So I'm doing those things before I call 911, or is 911 the first thing?
I think you do those simultaneously,
Okay.
and hopefully you can. But the first is to say, hey, how's the patient doing?
Okay.
How's my buddy? Is he or she, or the person you came up on, what's this circumstance and situation? Are they breathing? What's their airway? Are they bleeding to death?
Mm-hmm.
Beyond that, do I have cell service? Where's the cars? How far are we? How many of us are there?
Okay.
And if you have cell service, calling 911 right away is perfect.
Okay.
Get that process rolling. Get an ambulance at least to the parking lot. Maybe you're so remote you need search and rescue and you need specialized equipment.
Mm-hmm.
Maybe you need a helicopter. There's a lot of options and there's a lot of resources in our community.
Right.
We're lucky that way.
Oh, we are. Yeah. Okay. The few times I've done like CPR training, I think what I remember very clearly is the first thing they tell you to do is point at someone and say, you go dial 911 instead of somebody, because then nobody may do it.
A lot of times you have to take control of a situation and just direct.
Mm-hmm.
If you have enough people, then there should be somebody that is just overseeing these things, directing, saying, you do this, you don't do this, you go. It has to be coordinated by someone.
Mm-hmm.
If it's just you, it's really tough.
Right.
CPR is one of the hardest things you will ever do.
Physically?
Physically, it will exhaust you in less than 2 minutes.
Wow.
Exhaust
If you're
you.
doing it right.
It will exhaust you.
Okay.
It's very difficult. It's very emotional. But it's also an honorable place to stand in the world. If you really think about CPR, it's a bit existential, but I'm someone's heartbeat.
Mm-hmm.
I'm your heartbeat. I'm the thing between me and you and whatever we're on the other side of. And that's a really honorable place to be, is that I'm your heartbeat. Learning CPR, learning basic first aid, learning basic first responder ideas is an amazing thing to do. You can be such a benefit to so many people, including your best buddy, your partner, your kids. Well, I suppose if I had my druthers, I would make EMT training a mandatory high school class across the nation.
Okay. Cool. I don't remember what version of iPhone came out. I think it may have been 13 or the 14 that had the built-in satellite thing. So if you have no service, you can get it in SOS mode, get to a clear sky, and still text emergency services.
Yes. Things that are super important. Obviously, letting anybody know where you're going, when you're going to be back.
Mm-hmm.
Those are really important parameters. I've taken care of patients that have been out unconscious for 22, 23 hours and found by a trail runner the next morning.
Oh, wow.
So I've seen those types of things. They just didn't leave.
And it's so easy to do. I mean, with so many people are on Strava.
So easy.
Which has its own tracking thing. My Wahoo bike computer has a built-in tracking thing. So every time I start a ride, it sends a link to Ann. And, whenever I have a cell signal, it's updating my position.
Brilliant.
So she knows the last place I was at when I had a signal anyway.
Right. I've seen and taken care of cases in which the signal stopped for such a long time that they finally went in to find this person.
Okay.
And that's happened in different circumstances. It wasn't necessarily mountain biking.
Okay.
But backcountry skiing, this person hasn't moved in hours.
Mm-hmm.
What's going on? We can't reach them, and search and rescue's gone in.
Okay.
Certain GPS units, Garmin has one that text back and forth. There are SOS devices that you can hit, and if you hit the button, it activates a rescue system.
Okay.
Certainly being aware of your trail and trail system. Where's the cell signal going away? Where is it?
Right.
It's really nice to know that because it might come into play. So those are really important things to know.
Mm-hmm. So if I'm going out on a ride solo, which I personally do often, besides telling Ann where I'm going, when I expect to get back, what should I bring with me? So that if I come across somebody or if I'm hurt myself, I'm reasonably prepared, but at the same time know that the more I carry, the bigger bag I need and the more work I'm putting in to haul stuff with me.
First, let's address taking care of yourself. That's obviously just riding moderately. I'm 50. I don't want to get hurt ever. I don't want to recover from a major injury. I don't mind the scuffs and the bumps of things. That's fine, right? But I'm not 20 anymore.
Right.
At all. And healing up from a major injury is potentially life-changing beyond 50 years old.
Mm-hmm.
I've seen that happen where one injury turns a person's life just a different direction, and off they go into a really difficult place. And that's part of living.
Mm-hmm.
You never want to like stop adventuring, but riding moderately, knowing your trail, and just enjoy.
And risk assessment. I've talked to so many people. It's like, do I want to do that thing, whatever it is, whether it's a 10-foot gap jump or just a rock garden, that you may or may not have the skills for, and maybe let's assume that you do have the skills for, but the 1% chance that you're not going to perform on it, you've got to decide, is it worth that risk? If you don't clear it,
what's the benefit?
Yeah.
Who's going to notice?
Right.
It's going to make me way famous. It's going to pay me $7 million. There's a lot of that, right? And what is that risk assessment is super important.
Mm-hmm.
Then to the level of what are you wearing? I recommend all of us at this point in our lives to wear a helmet with a face guard.
Okay.
The amount of face injuries that I see.
Oh, I bet.
Dental injury, jaw fractures, nasal fractures, orbital wall fractures. The facial injuries happen in mountain biking because we go ass over tea kettle, and there we are on the dang ground.
Mm-hmm.
And there's a tremendous amount of injury that could be prevented with just wearing the full face mask helmet.
Okay.
Recommend it. Certainly, we're not riding without any helmets. We have to ride with helmets.
Right. It's very rare these days when I find somebody without a helmet.
Because I think helmets are cool now. They may not have been cool when I was 20 years old.
No, they weren't.
I don't think they were. They were bulky and ugly, and nobody really thought they were cool. And I always talk to young people when they come in with skateboard injuries or other things and say, where's 2 + 2? And they say, oh, it's 4. I didn't ask that.
Mm-hmm.
Where is 2 + 2? And it's in your brain. And that's also where your favorite color is.
Mm-hmm.
And your name and your identity and your memory and your skill set, even your ability to wipe your own bum, is in your brain.
Mm-hmm.
And there's just absolutely no reason to not wear a helmet. I would add the enhancement of a facial guard on that helmet as an additional layer of protection from facial, jaw, dental, eye, and nasal injuries. Eye protection, big time, because I see a lot of corneal abrasions from leaves, branches, bugs, foreign bodies that get into our eyes. So
have nothing to do with crashing. It's just, you're just riding.
Just riding.
Yeah.
And then, so that really helps. I really enjoy the idea of having the knee and elbow protection on as well.
Okay.
One injury you see a lot in the ER is a patella fracture. So the bone that floats in front of our knee.
Okay.
You hit and land on that and smash it.
Mm-hmm.
It's a devastating injury. It's just out there in front. It's just waiting to hit a rock, waiting to hit a tree.
Right.
And when it smashes, they have to go in and sew that bone together with wire. It can be a very devastating injury.
I bet.
Similar with elbows. I enjoy having the knee pads and the elbow pads, the helmet, the face guard, the eye protection. And I think that's a reasonable thing to ride moderately, know my limits, risk assessment. And that's the assessment for you riding alone. That's
Okay.
a lot.
Yeah.
Riding and coming up on someone or having a partner be injured, I always think that it's wise to have some level of first aid training, a first responder course. These are offered in our community almost ubiquitously. They're everywhere.
Okay.
You can find these things on routine web searches for local first aid courses. I think that's a reasonable and wise thing to do. My brother and Jake and I did a ton of climbing in the Tetons.
Mm-hmm.
And I had my EMT, and I had this advanced level of medical training and working on my paramedic. And I would always look at him like, what are you going to do for me? What
Right.
the heck is going to happen when I'm unconscious?
Right.
And he and I, since we climb so much and so often in such remote alpine environments, I just asked him to go do an EMT course.
Mm-hmm.
He did that, and we felt so much better about being in remote areas because both of us had reasonable training together.
Okay.
I was grateful for that for him, and it's passed on to his kids and everything else. It's a tremendous thing to have. Coming up on that with that training will inform you. It'll inform your brain and inform your mind as to how to act and what to do when you need to do it. Always just reassess. How's the airway? How's the breathing? How's the circulation?
Mm-hmm.
Where are we? What do we need to get out of here? Couple things that I think are reasonable to have in a basic backpack.
Mm-hmm.
All you need is a couple of 4x4 bandages, something to stick over something that got punctured or rubbed wrong, and some tape, a little roll of tape. You can put that over any little small pencil or something like that and just throw it in your bag. I love having a SAM splint. A SAM splint is it's a thin slice of aluminum with foam padding on the outside.
Okay.
I would say it's about the size of maybe a large phone. And if you unfold it, it's long enough to splint onto an arm
Oh, cool.
and specifically a wrist. You can roll it up and put it under your wrist. Everybody look up a SAM splint on your Google search while we're talking, and you can see the many applications of it. And having a little ace bandage can really help wrap this up. And somebody could walk out with a broken wrist and have it splinted and be so much more comfortable than
Okay.
having to walk out with a wrist splint or a forearm fracture or wrist fracture without it.
Okay.
One other thing I think is really, really helpful is a couple of large safety pins.
Mm-hmm.
You can do a lot with a safety pin, including all you have to do is just pin somebody's shirt up in a sling to their collar on their shirt, and you have a sling for a dislocated shoulder, a fractured collarbone, and a acromioclavicular or AC separation injury. So it's super helpful for just splinting things.
Okay.
I don't have to carry a sling with me in my backpack. I've got a
Safety pin, and you've got a shirt.
Right. Pin it up, and you've got an arm sling. So
Okay.
it's super helpful. In extreme environments, and it sounds really weird, but a safety pin you can open this, stick it through an unconscious person's tongue and lip, and hold their airway open. If there's only one of you, it's really hard to do anything else other than hold somebody's airway open and keep their tongue from obstructing their airway.
Okay.
If they're really, really out and it's really, really bad, you can stick a safety pin straight through their tongue, straight through their lip, close it up, and it holds that tongue out of the airway. And you can now dial your phone. You might be able to do something else. So that's an extreme example, but it's something that you can do. So I don't carry small safety pins.
That's a big one.
I carry reasonably large, medium-size safety pins because I can do a lot with them. Beyond that, an ace bandage, and I wouldn't carry much else.
Okay.
It can bog you down. And
Yeah.
But if you have 2 or 3 things that you can use in a big emergency right away, and it's reasonable, I think that's fine.
Okay. All right. Sweet. Well, let me ask you this: what are the most frequent injuries that you're seeing on a mountain bike which causes you to really kind of scratch your head or ask yourself, this was so basic, why you could have done this to put yourself in a position where we had so many more options once you got to the ER, but you didn't.
Well, ERs are places where we have a lot of resources, and I don't know how many bodies you have, but I only have one.
Mm-hmm.
And when there's an accident or an injury, you've only got one body. If you have a question that it needs addressing, come to the ER. We'll take care of you, regardless. I don't care if your hair hurts. That's impossible. And that's the honest assessment of like how we accept people into our ER. I don't care why you're here. I just want to take care of you. Whatever happened, I want to make it better right now. So the most common injuries in mountain biking are usually wrists, shoulders, faces, knees.
Collarbones?
Yep. So the collarbone, the clavicle, is the most commonly broken bone in the body, by far.
Not necessarily mountain bike related.
No,
it just happens all the time.
The most commonly broken bone.
Okay.
It's the most commonly broken bone in mountain biking. It can have problems such as a punctured lung. It can dislocate. It can have all sorts of bleeding with it. Vast majority of them heal without surgery. Shoulder dislocations, really, really common.
Okay.
Those are hard to redo in the field. There's a few techniques that you can look up. One of them is called the snowbird technique, and you can do that with a shirt or a sheet if you're really, really out there. But I don't recommend anybody without medical training trying it.
Okay.
Unless you're really, really out there. But there's shoulder dislocations, really common.
Okay.
Acromioclavicular separations, we call them AC separations. You can, again, look this up on Google while we're talking and see what it looks like. And it's at the very end of your clavicle, at the very distal end of your shoulder, and sometimes this just separates and it looks like you have a wing bone. It's actually your shoulder dropping because the ligament holding your shoulder and your clavicle together has ruptured.
Okay.
That's very, very common injury. You can have really bad injuries with handlebars going into your abdomen. And a lot of people might even write that off and say, oh, it's not that bad. It's just a bruise. But you have a liver under there, and you have a spleen under there, and you have all sorts of other organs in there, like a pancreas and things like that, that might bleed.
Okay.
If you're having problem or difficulty or severe pain after a handlebar hitting your abdomen or chest, come in and get evaluated.
Okay.
Easy to make sure that you're not having a ruptured spleen, a lacerated liver, or bleeding internally. Don't leave those to chance.
Okay.
If they're bad, they can be really...
Here's a potential easy one. I often see people that don't have bar end plugs. How often do you see injuries like that where it's basically like a cookie cutter that's going right through like a limb? Yeah.
I've seen handlebars go through legs near femoral arteries. And so, yeah, there's probably some things that you could do to modify your bike so that you reduce handlebar penetration.
Well, put bar ends in.
Well, hopefully
they're cheap enough. Right.
But they can be really bad injuries.
Okay.
No question.
Yeah. Do you come across people who are hesitant about calling 911 or going to an ER based on their limited insurance or lack of insurance? And what would you advise them?
Yeah, it does. It influences a lot of choices. And ERs are very expensive places, unfortunately.
Sure.
They're very, very efficient. And that's always a conundrum for people. It's super hard. I lived most of my life without insurance as a ski bum. I understand that. So it weighs on all of our minds in some way, shape, or form, depending on your copay or you've got a catastrophic program or no insurance whatsoever. There are ways to go to, other providers. You can certainly have 911 evaluate you. They're helpful for screening. And if you decline some of the services, then you don't need to be transported. They're helpful in the field. Coming into a clinic like an Instacare can sometimes just offer, if you just need an x-ray, you have an isolated injury and it's not a full system injury problem, like, hey, I need a CT of this, I need a CAT scan of my brain, I've got 2 arms broken at the same time, then you need to, maybe you can consider a cheaper alternative such as an Instacare or a clinic.
Okay.
And those are sometimes helpful. We will take care of anybody regardless of ability to pay as providers. The back end of that answer, of course, is that there are collections agencies and hospitals that it's complicated.
Right.
But ER docs will take care of you regardless.
Okay. And then you just have to figure out how to deal with it later.
We have social workers in almost every ER in America, and they are there to help people navigate their insurance. They're helpful for navigating Medicare, Medicaid, non-pay, pay for cash. There's all sorts of different options that are available and usually provided to you through a social worker in emergency departments.
Okay.
And that they can be very, very helpful. They can help you understand what your program even says. They're trained in that.
Okay.
That's a helpful resource.
Oh, I bet. Yeah. I mean, it's got to be something pretty
If you're really
difficult to navigate.
Please don't avoid us.
Mm-hmm.
Come in and let us take care of you.
Right. Okay. So I know you've got some horror stories, which will probably gross me and other listeners out. Give me some good stories where something horrible happened, but people did things the right way and they got to the ER and everything worked out good because they implemented some or all of these steps that you've been talking about. So they were prepared and they were able to deal with it.
Well, there's lots of local stories that have happened on our local trails, ones that you've ridden, and bad things happen. And there are really big time catastrophic accidents that happen on a routine basis, unfortunately.
Mm-hmm.
It's kind of funny for the amount of mountain biking that happens. I don't see as many injuries as I would expect. For the most part, I think a lot of us are really safe
Just
out there.
because of all the traffic that's out there.
Bike, and I don't see like a train of accidents in my ER,
Okay.
let's say, but I see them on a fairly routine basis.
Okay.
But some of these require helicopter extraction. Our Life Flight team here, at least with the McKD group and our local hospitals, has a capacity with a hoist on it. So the helicopter has a cable that dangles out of the side of it, in which a paramedic or a nurse that will be trained to do this type of work can lower down into the brush, the tree, the side
So they can
of the
get
cliff,
anywhere.
and they can basically.
I've seen them training at the lot up at Snow Basin, and it's just mind blowing.
Huge amount of training.
Yeah.
Very dedicated individuals, brilliant, these flight teams
Mm-hmm.
of all stripes. But then this cable or this hoist mechanism is a whole kind of different level. And they've had to use that even this year a couple of times in local trails to extract mountain bikers that have gotten into some serious trouble
Okay.
with major spinal injuries, paralysis, internal bleeding, and things of that nature. That said, though, people were able to act. They were able to either get service or right to self-service, activate the right protocol, and say, we're not going to get to this person unless we get a helicopter up here.
Mm-hmm.
So their knowledge of what our resources locally are really helpful.
Okay.
We have a search and rescue team. They'll go anywhere.
Okay.
We have horses, snowmobiles, drones, helicopters, mountain bikes. They have all sorts of, side-by-sides. They can get to us.
Okay.
We can get to you.
Well, and we got there ourselves, so that tells us that somebody can get yeah.
Somebody else can get there to help you. Using some of those resources, though, is really the most important thing to know about what I need now in an injury pattern. I need this, and we're not going to be able to do this ourselves.
Okay.
Call in the backup, call in cavalry, call search and rescue. 911 will help you dispatch what you need to. But there's a lot of people that have been injured in major catastrophic ways. Both legs broken, femurs sticking out of legs, unconscious, not breathing, spinal cord injuries, paralysis, pneumothorax and collapsed lung. And they bring those folks into the ER on an emergent basis. We activate them as a level 1 or a level 2 trauma. And that brings a whole cadre of resources into the room where we have ER physicians, we have trauma surgeons, we have ICU nurses, trauma nurses, ER nurses, full blood, all sorts of medications, pharmacists, technicians. Everybody's in that room waiting for these people to arrive so that when they hit our door, we initiate getting them better to the extent that we can.
Right.
And a lot of these things,
That's so powerful. It's just crazy.
it's a miracle. It's a miracle. When I'm sitting in those rooms, I often sit and wait for the patient to come in, and I'll ask myself, how many tests, how many board exams, how many nights in libraries have all of these people dedicated to be in a position to be in this room?
Mm-hmm.
It's a miracle. This person, he's been over there training on how to put EKG stickers on and read the EKG right away. Amazing. This surgeon has been like, he or she is so nerdy that they love taking gallbladders out for a living.
Mm-hmm.
But as a side effect, they're there and ready to perform emergent life-saving surgery immediately. And it's really a powerful moment to be in those rooms, to look at all these men and women that are there for all of us for any accident that happens any hour, 24/7, 365. They're even there on Arbor Day.
Really?
I know.
Arbor Day.
I
That's
know.
hard to believe.
But it's really something that actually inspires me. It motivates me to work really hard
Oh, yeah.
and to be the very best that I can be so that I can be ready for you or for my loved ones when they come in with these catastrophic injuries. and make it better
Right.
right now. That's a really powerful message. And all of our paramedics, our EMTs, our search and rescue volunteers, they're all out there. They're training on a random Saturday so that when I'm injured on my mountain bike on the top of Ben Lomond, they can come and get me.
Right.
How do they get there? How do they know what to do? It's amazing these men and women are doing this all day, every day. And it's a byproduct of their lifestyle. In my estimation, it's the people that are on the front lines of humanity that have that same heart. I need to be there for you when you need me. That drives them. And they're out there. They're at a fire station right now. They'll be there at 3 a.m. And the search and rescue, she's out there learning her kayak roll right now. For what? So she can be ready for when you need me.
Right.
That's amazing.
That is.
Ski patrollers are out there studying their avalanche stuff right now in anticipation of the new season. They're doing that so that they can save you when you need them.
Right.
All of these people are out there and they're working for you and me to be the best that they can be when I need them.
That's awesome. And you're one of them.
Thank you. It's awesome to be a part of. It's what makes me feel good about me.
Right.
Yeah.
Yeah, that's so cool. Sweet. I think that's probably a really good way to wrap it up. I got goosebumps just listening to you.
Thank you. I really appreciate you having me.
That was awesome.
Thanks so much.
Thank you.
Well, that's another lap around the bike park for Aging on Dirt. I hope you've learned something and or found this entertaining. Most importantly, go out and apply what you've learned so you can experience more joy on your bike. Remember, Joel wants your input. What topics and or guests do you want to hear? Reach out to him where you're listening to the podcast, on Facebook, or find his email/phone on his coaching website, jzmtb.com. Until next time, have fun and be safe out there.